Hello, and thank you for joining me. My name is Dr. Regan Pyle, and I am a practicing allergist located in Colorado. I would like to share with you today the story of one of my patients with severe asthma and why I chose to treat with TEZSPIRE, tezepelumab-ekko. TEZSPIRE is approved as an add-on maintenance treatment for adult and pediatric patients aged 12 years and older with severe asthma. TEZSPIRE is not indicated for the relief of acute bronchospasm or status asthmaticus. In two pivotal studies enrolling a broad all-comer patient population, meaning no baseline biomarker level requirements, TEZSPIRE reduced asthma exacerbations by up to 71% in the Pathway study and 56% in the Navigator study compared to placebo. In addition, TEZSPIRE is the only biologic to demonstrate a statistically significant reduction in exacerbations in patients with blood eosinophils less than 300 cells per microliter. TEZSPIRE provided a rapid improvement in lung function that lasts. Treatment with TEZSPIRE improved FEV1 by 230 milliliters over baseline at 52 weeks. Moreover, 70% of the lung function improvement was achieved at 2 weeks. Please note that TEZSPIRE is not a rescue medication. Compared to placebo, TEZSPIRE impacted asthma exacerbations leading to ED visits, urgent care, or hospitalizations. TEZSPIRE was shown to reduce these exacerbations by 79% versus placebo. Results of this analysis are descriptive only. TEZSPIRE is contraindicated in patients with a known hypersensitivity to tezepelumab-ekko or its excipients. Reactions, for example, rash, allergic conjunctivitis, can occur after administration of TEZSPIRE. These generally occur within hours of administration but can have a delayed onset. Consider the benefits and risks. Do not abruptly discontinue corticosteroids. Dose reductions, if appropriate, should be gradual and may be associated with withdrawal symptoms and/or unmask previously controlled conditions. Treat patients with pre-existing Helminth infections before starting TEZSPIRE. If patients become infected while receiving TEZSPIRE and do not respond to anti-Helminth treatment, discontinue TEZSPIRE until infection resolves. Avoid use of live attenuated vaccines. After seeing the TEZSPIRE clinical data, I started thinking about patients in my practice who could be appropriate for TEZSPIRE. I would like to share with you the story of a special patient to me named Zach. Zach is a 13-year-old adolescent who has always loved Transformers and robots. He even brings them to his office visits to show me his latest creation. He was referred to my practice when he was just 6 years old. Prior to arriving to my care, Zach had already been hospitalized twice requiring supplemental oxygen because of his severe asthma. Zach and his parents have always been compliant with his medications, which include an ICS LABA and additional add-on medications. He is also on allergen immunotherapy for his perennial allergens. Despite this treatment, Zach experienced daily cough and 2 to 3 asthma exacerbations per year requiring oral steroids. His percent predicted FEV1 has routinely been between 60 and 70%. My goal was to improve Zach's asthma control. Asthma has restricted his activity for a long time, and as he begins his teenage years, I want him to have fewer exacerbations and improved lung function so he can be as active as possible and not feel as limited by his asthma. It has been challenging to identify a single driver of Zach's asthma. On his last visit, Zach's total serum IgE was greater than 400 IUs per milliliter, and his blood eosinophil count was around 100 cells per microliter. However, he had recently completed a steroid taper, so his actual blood eosinophil count might be higher. Zach has several asthma triggers that are difficult for him to avoid, which have contributed to his symptoms and exacerbations over the years. These triggers include cigarette smoke, dog and cat dander, viruses, exercise, and cold temperatures. He has several relatives who smoke, and his family has several dogs and cats to which he is allergic. Knowing that TSLP is released from the airway epithelium at the top of the inflammatory cascade in response to asthma triggers, and that TEZSPIRE was studied in a heterogeneous, all-comer patient population, I recommended to Zach and his parents that we try TEZSPIRE. We reviewed all the various treatment options available and our treatment goals. After a group conversation with Zach and his parents, we made the shared decision to add TEZSPIRE. I explained that his individual results may differ from what was observed in the clinical trials. Zach, his parents, and I discussed the safety information that I stated previously, the potential risks and benefits, and the most common adverse events associated with TEZSPIRE in the clinical trials, which included pharyngitis, joint pain, and back pain. I encouraged Zach and his parents to read the patient information available at TEZSPIRE.com. Lastly, I explained that Zach would come into the office every 4 weeks to receive TEZSPIRE by subcutaneous injection. Zach was recently started on TEZSPIRE. I checked in on him and he reported overall less tightness in his chest. I will continue to monitor his progress and we remain optimistic. I look forward to seeing him back again in the office soon, where I know he will tell me about the newest robot or transformer that he designed and created. Thank you for listening to my TEZSPIRE moment. I have just shared how I made the clinical decision to prescribe TEZSPIRE, the first and only biologic approved for severe asthma without phenotypic or biomarker limitations. I invite you to review the full prescribing information for TEZSPIRE, including patient information, at tezspirehcp.com or call 888-TEZSPIRE. That's 888-897-7473.